Hi, this is Philip Pador, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about Buerger's Disease. Let's get right into it. What would happen if you narrow the blood vessels in your fingers and in your hand? Well, of course, we'd see a decreased blood flow, which means decreased oxygen delivery to the tissues, right? Decreased oxygen delivery to your fingers, which can lead to pain. It's very similar to what happens in the heart. If you have a decreased blood flow to the heart, then you can feel anginal pain. Anginal chest pain here is very similar. You get a muscular pain, which is known as claudications. Now, what happens if the blockage is so severe that you have complete blockage? It's no longer narrowed, it's just a complete block off. Well, you're not going to get any more blood into your fingers. And so, makes sense they're going to die. The cells in them are going to die. Your fingers will fall off, and this is called auto-amputation. These are the two main symptoms found in the vasculitis called Buerger's disease. Recently, there has been a movement in medicine in trying to rename diseases that are named after the guys like Buerger's. And they're trying to make it easier for people like us to understand medical terminologies. And so they're trying to rename the said diseases. In this case, they've renamed the Thromboangiitis obliterans. So much in really helping us understand what it really means, right? Well, let's break it down. It may be a mouthful, but when we take a look at it, it actually makes a lot of sense. Thrombo means clotting, right? And angiitis is an inflammation of the blood vessels, which is really the root of vasculitis. Vasculitis. Angiitis was just another name for this. And lastly, obliterans, which is a term for artery occlusion or artery blockage. Obliterans pretty much means blockage. So here we get confirmation, vessel inflammation, and blockage. We can think that there's a vessel inflammation, disease-causing clot, in which creates a blockage in blood flow. So you see these symptoms of claudications, autoamputations, death of the cells, necrotizing vasculitis. Other symptoms that you see are ischemic ulcers and gangrene. These are all terms for the same thing as ischemic ulcer. Blood flow, blood decrease causing skin damage, gangrene, cell death of the fingers and toes, damaged dead cells. This is not just the hands. Actually, the feet are involved as well. Most common symptoms is a forefoot pain. Pain right here. Now, this can be diagnosed with an ultrasound, taking a look with a probe and seeing what it displays on the screen. And here, we will see the narrowing of the blood vessels. Not only that, but you can also use an angiography. An angiography is a way to visualize the insides of the blood vessels. What you do is, you have a patient take this fluid called contrast that has a high radiological isotope. Basically, it can be seen when you view something like an X-ray or scan, a radiological scan. And so it gets absorbed into your bloodstreams and allow physicians to visualize how the blood vessels look on the inside. So if there's a blockage in the artery, the physicians will see the narrowing because there's a less blood flow through an area. Another thing you can see in the angiography is some spiraling, a corkscrew pattern of arteries around a blockage. So arteries create this corkscrewing because they go through a pattern of growth damage, regrowth. They're trying to create a fresh artery. A risk factors of this disease is smoking. The pathophysiology isn't quite understood, but it's believed that something in the tobacco or something in the cigarette that is causing the immune system to respond. And for some reason, vessels on your hand and your feet are affected. The only definitive treatment is to stop smoking. There is no medication that really can be given to stop the progress of this disease. So patients are urged to really quit. Otherwise, they may lose their fingers or toes. The nursing management for Buerger's disease is that the nurse teaches the patients to avoid situations that may be stressful or unsafe. Stress management class may be helpful. Exposure to cold must be minimized, and in areas where the fall and winter months are cold. The patients should remain indoors as much as possible and wear layers of clothing when outdoors. Hats and mittens or gloves should be worn at all times when outside. Fabrics specifically designed for cold climates are recommended. And finally, patients should warm up their vehicles before getting in so that they can avoid touching a cold steering wheel or door handle that could elicit an attack.